Histaminic receptors, H1 receptor, this is GQ coupled, smooth muscle endothelial cells, brain. H2 is GS coupled, gastric mucosa, cardiac muscles, mast cell, brain, इधर ये पाए जाते हैं. H3 is GI, found in presynaptic, in brain, meninteric plus and neurons. H4 is again GI, eosinophils, neutrophil and CD cell. These are the histaminic receptors. Biological role of histamine, number one, effect on CNS. A powerful stimulation of sensory nerve endings, especially pain and itching, is produced when histamine is bound with the H1 receptor. This is the neuronal cell, again consider it. This is the H1 receptor, this is the H2 receptor, this is the H3 receptor. H1 receptor is GQ, again these intracellular signaling stimulating PCL, then cutting PIP2 into IP3 and DAG, both stimulating kinase enzyme, and they then stimulating lot of other pathways, including this stimulation of calcium channel, increased calcium channel, and this increased calcium channel speed up the release of neurotransmitter, and these neurotransmitters are responsible to create pain. They can create itching, even is the airways. If there is itching in the airways, they creating cough. Similarly, these neurotransmitters also interact with the CTZ. CTZ then in vomiting center, and they can produce MSS. Similarly, this kinase enzyme can dilate small blood vessels. This dilation is through various mechanisms. Let's suppose the release of EDRF, endothelial derived relaxing factors, and this dilation of these small vessels in the brainstem and labyrinth, they decrease vertigo. Similarly, the stimulation of this H3 receptor in the CNS, they inhibiting the protein kinase. So when protein kinase is inhibited, no calcium is released, and there is no release of neurotransmission, and inhibitory action will produce just like sleep. H3 receptor agonist will produce inhibitory effect just like sleep. Other actions are effect on CVS and blood vessel. The histamine produce dilation of small blood vessels, especially in which there is no smooth muscles. For example, arteriole, but contract large blood vessels. How the histamine dilate the small vessels? There is H1 receptor. When they are stimulated by histamine, they are HQ, PC, PLC, IP3, DAG, stimulating kinase enzyme, and this kinase enzyme then inducing, expressing endothelial derived relaxing factor. Now these factors stimulating nitrous oxide synthase enzyme, these enzyme producing nitrous oxide, nitrous oxide then converting AGTP into CGMP, and this CGMP then stimulating protein kinase C enzyme, and that protein kinase C enzyme then producing vasodilation, smooth muscle regulation, platelet inhibition, and so on. When there is vasodilation, this is before dilation, the blood capillary before dilation, endothelial cells, the epithelial cells are so tightly joined here. But once there is vasodilation, these cells producing gap in between, and so there is oozing in between. The fluid from this capillary will ooze out in these gaps, and this will produce oedematous condition. This will produce flushing. Histamine produce flushing, and the mechanism is this one कि after dilation एंडोथेलियल सेल्स के दरमियान गैप पैदा हो जाता है, इस गैप के दरमियान फ्लूइड आउट आ जाता है, मोस्टली ब्लड सेल्स तो नहीं होते लेकिन they produce edema or oedema and flushing. Once there is oozing out, once the fluid is come out, the plasma volume is decreased and venous return is decreased, and so blood pressure is decreasing. But in large blood vessels, when H1 receptor is stimulated, again they consider recall this mechanism. This DAG and IP3 stimulating kinase enzyme, they're producing stimulating calcium channels, and calcium channels increasing, they causes contraction. So this contraction on heart increase sinus rate, positive chronotropic effect, increase ventricular contraction, positive inotropic action, and increase they cause tachycardia.